forceps. That's going to be our next section. So think of that as almost like your tray 3. So we have tray 1, tray 2, and forceps. Okay. As part of forceps, we're also going to have the pediatric tray. When we pass off, we'll be passing off on tray 1, which will be next Tuesday. Okay. There'll be tray 2, and then forceps and the pediatric tray. Okay. So that will all be as one. As a reminder, next week for tray 1, that encompasses 1, 1, 1, 2, and 1, 3. Okay? So all of those count as tray 1.
You said next Tuesday?
Next Tuesday. Your accessory tray that we have will fall under, or the miscellaneous tray, I believe it's called, will fall under tray 2. Okay. All right, so forceps. Now all forceps are going to be the actual instrument that we're using to remove teeth or roots from that bony socket, okay? So the function for all forceps is basically the same. Remove teeth from that bony socket. With the elevators, we learned that's kind of separating, right? That's starting to separate and loosen the tooth. Then we go in with those forceps and actually take the tooth out, okay? All right, so they're separated maxillary and mandibular. So we're gonna start with the maxillary. First one we have is the 150 maxillary universal. It's known as a crier, okay? There's a couple of reasons why. So if you look at it, it has this teardrop shape, okay? So I'm gonna show you that as compared to say what our next one will be. So it has more of a teardrop shape, okay? So if you think teardrop, crier, okay? So 150 crier. Remember, this is going to be for maxillary teeth. This is considered a universal, okay? So it can be used anywhere on the maxillary teeth. Specifically though, it will be, if you were to look in your book, it says maxillary anteriors, premolars, and roots, okay, just root tips. But it is a universal maxillary forceps, okay? We will learn that, so the 150 is maxillary. We're going to learn that the 151 is the mandibular one. We'll get to that and I'll show you the difference between the two once we get there, okay? So 150, I'm gonna pass this around in a second, but I wanna show you the next one. So with all forceps are gonna adapt on the buccal and lingual side. So, the oral surgery one is over there, so just to give you an idea. So that's going to be this tip here. So you want to imagine the way that this is going to orient on the tooth is basically near that kind of cervical line. Okay, so higher up on the tooth. We're not going to be using it here. What do you think could happen if we try to use a forceps here, right? We could snap the tooth because that's not where we're going to get the best grip, or it's not going to be kind of in a point on the tooth that we're going to be able to use kind of that force to get it out. So the tip is going to fit facial and lingual right apical to that cervical line, okay? So if you imagine that that's your cervical line here, you want to think about that this tip will adapt in that spot, okay? So see how it's kind of flatter across? That way it's going to get a good grip right at that, basically, cervical line.
Oh,
okay. So that's where you want to think about where this would get adapted. So in this spot, they would then rock buccal and lingual, okay, to then pull the teeth out. But that's where you want to imagine that these are going to rest, okay? So that's where they'll adapt. 150 crier, teardrop shape. You can think, I'm crying because all my teeth are coming out. Okay.
Which is a nice name for that.
Right. So 150 crier. So I'm going to show you a second one here. This is called the 99C. This is for maxillary anterior and premolar. Okay. The big difference is this is flat. If you look, it's completely flat. Okay. Totally straight and flat. Basically the same idea. Everything is going to be to remove teeth from that bony socket. It's going to conform to facial and lingual root contour, kind of right at that apical line. it becomes kind of personal preference. 150 is universal, you're gonna be able to kind of use it anywhere. Remember we learned a little bit about the straighter an instrument is, the more anterior. So this would not adapt to a posterior tooth, or a molar tooth, right? Because technically premolars are posterior, but they're a little bit more shaped, kind of like an anterior tooth, so you could access a premolar with this, even though it's very straight. So 99C, flat and straight. Okay. So I'll pass. Maybe we'll end them with these. Whatever. Once those come back around, I'm going to compare how the maxillary and the mandibular look a little bit different, and way that you can differentiate. Because like I said, we'll have the 151, its mandibular counterpart will be, or vice versa, that's a 150, mandibular counterpart is 151. Alright, so the third one, maxillary forceps, there is only 3 that we need to know. This is called a number 65, or a bayonet. The bayonet has this really curved aspect. Its function is not only to remove the teeth, but this is helpful for tooth fragments and root tips, okay? This curved is able to access that a lot better. So maxillary overlapping anterior. So let's think about that for a second, okay? So maxillary anterior overlapping. So let's say we have a tooth that's overlapping, okay? So we need to extract the tooth that's behind there. So we go in with our elevators, make a little bit of room, okay? We still have a tooth kind of in front of it. We need something that's going to be able to go in and behind there, okay? So see how it's kind of curved so that you can access behind a tooth that's already there. So if we were gonna do this one's a little harder to access around that tooth. If we're just kind of, I wouldn't be able to get to that tooth very well because of this bend, as opposed to one of the straight ones where you would just go straight in, or there we go, right. So 150, 99. So we want to take this, we just go straight in, get it. Okay? We want to just go straight in. You get this weird kind of the bend on there. So this is going to be just so that we're able to kind of get in and behind something that's crowded. Okay? 65 bayonet. Okay. So those are going to be the 3 maxillary forceps that we're going to learn. Any questions so far? So for maxillary forceps, number 150 crier. Make a note, kind of the teardrop shape. Crier, it's going to make you cry because all of your upper teeth are coming out, or all of your teeth in general. Okay, because we'll learn the 151 is a crier as well. It's a universal, so you might want to underline universal under the features. Universal, so you can use it in the left and the right quadrant.
So all of these are just for maxillary.
Maxillary. Yep, these are all maxillary.
Is there a difference between 150 and 151 except for the size?
The 150 is a maxillary. The 151 is only mandibular. So we'll learn that's coming up next.